This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, so yesterday, if you were the oncoming night group, you heard lesson. Anyone remember lesson's medical minute from last night? Anyone? Irrigation. Yeah, so it was like wound stuff, and he was saying how crazy it is that we use like sterile saline. You can just put someone's hand underneath the tap water. It's kind of more of a volume thing rather than the type of solution. So then I was thinking, I have to pull together a medical minute, and I was thinking, what do people throw on their wounds? And I was thinking about that movie, Saving Private Ryan. Who has seen Saving Private Ryan? What do you remember? Like, there was a wound, and what did they do to it? Anyone? Close. They did not chop off the arm. There was this yellow powder they threw on it. Does that ring a bell with anyone? Yeah, so it's this yellow powder, and I was kind of wondering what it was. I thought it might be something sulfa-y because it was yellow, and as it turns out, it was this thing called Prontosil. That sounds like right away you're going to put something on that cures the wound. It is a sulfa powder. It was designed by this guy, Gerhard Domagk, in 1932. And basically Bayer, the German pharmaceutical company, was looking at different dyes that could be used for wound care. So before they used to just clean out wounds, this was actually one of the first like topical antimicrobials, and it works pretty well. Like sulfa drugs, think it works for like MRSA, that sort of stuff. So that was a good idea. So going back even further, the ancient Egyptians used crazier stuff on wounds, and they put things like honey. And I was thinking, honey, that's kind of nasty. You get like a wound and it's going to be all sticky and gross. And I thought like, well, maybe it's sweet. It would attract more bacteria to feed on that delicious honey. As it turns out, honey actually has antimicrobial properties. You put the honey in your like pantry and you sit there and it like doesn't get mold or doesn't get gross. So it actually works pretty well. They also put lint. I'm on, oh God, that sounds nasty. Honey and lint. The lint actually absorbs stuff, so that's good. They put grease, and I thought, that sounds even nastier. Honey, lint, and grease on a wound. But think about, like, our wound care theory now is a lot of times to keep the wounds kind of moist, so the grease locks in the moisture, so that makes sense. Then moving on to, that was ancient Greece. The Greeks, they used clean water, just like underneath the tap. So they had these giant aqueducts, with the arches. The Greeks also used vinegar, which seems like it would sting, and wine seems to make sense because like alcohol, that would kill stuff. Then our friend Lister of Listerine fame came along in 1860, carbonic acid, wet to dry dressings. People still kind of use that. Who's heard of Dankin solution? Yeah. Dankin, so that's hypochlorite. And then we do fancy things, even maggots, and I'm not lying on this, Google Lassac and maggots. It's like this little, here's the problem with maggots. You throw them on the wound and they just start running around. So you're in the ICU and you want to contain your maggots. I have no financial affiliation with Lassac, but there's this product called Lassac. It's your maggot sac, which you can attach to keep the maggots in control so they just stay in the wound. So that's in addition to Lessons wound care from yesterday. Take care.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.